health care for persons with schizophrenia. So we talk about integrated care because there is evidence that there are widening disparities between the general population's health and populations with a chronic mental illness. People with schizophrenia live shorter lives, depending on what data you look at. So how shortened that is kind of varies, but you'll see numbers anywhere from 10 to 25 years shorter lives. And they're not dying earlier for any reasons specific to mental illness. It's from the same medical conditions that plague everyone else, things like cardiovascular disease, metabolic syndrome, obesity, diabetes, pulmonary diseases, and infections. When you look at individuals with a diagnosis of schizophrenia, you'll see that some of this has to do with modifiable risk factors. There are higher rates of alcohol use disorders, higher rates of smoking, lower rates of general physical activity, higher rates of sedentary behavior. They tend to consume more calories per day and actually have less sleep and poorer quality of sleep. When you look specifically at persons with first episode psychosis, you again see these higher rates of alcohol use disorder and tobacco use. Again, less active, even more so than individuals with schizophrenia. Really poor sleep and quality, reduced sleep time and quality of sleep. There's not enough evidence in the literature that I looked at to speak too much to sedentary or diet, but I'm sure that evidence will be coming out with some time. This isn't a great slide, but what it does show is that when you look at the daily intake of certain nutrients, you see a much higher intake for persons with schizophrenia in all of these categories, with I guess the exception of fiber. So schizophrenia, bipolar, and major depressive disorder are all taking in about the same amount of fiber as the general population, but significantly more carbohydrates, more sugars, and more fats. So, I mean, and saturated fats. So obviously, when that is a higher portion of your daily consumption, that's not good for your body. And there's been studies that have looked at the long-term impact of antipsychotic medication treatment on obesity. So there is a higher incidence of obesity, hyperlipidemia, or dyslipidemia, and diabetes in populations being treated with an antipsychotic medication. And the retrospective studies show that this is, overall higher. When you look at the 3-year weight gain of somebody who's been newly started on an antipsychotic medication, what you see is that the first 12 months of treatment are really critical for the weight gain and metabolic changes. So whatever interventions can be done early is going to be super beneficial to the longer term projection. The importance of early identification is, I mean, we all know this. We know that we need to be able to identify people early, and it's really identification of psychosis early and identification of these risk factors for medical conditions. Without it, we know that social and clinical outcomes tend to be more poor. We know that 25% of people will experience a relapse, and that common residual symptoms are very common. So many of the risk factors that go into this are really impossible or difficult to modify, and that's because there's socioeconomic factors that are at play that compound all of this. We know that there are higher rates of diagnosis of schizophrenia in poorer communities, and low-income communities also have a host of additional risk factors. So that's why we talk about integrated care. But when you talk about integrated care, it looks really different across the board. So this is one graphic, and you could find dozens about what the variations of integrated care could look like. So it goes from as low as some informal communication between mental health and primary care, or some, a little bit of collaboration protocol, all the way up to team-based care, co-location, bi-directional integration, and shared records. But most of the systems that we're in are somewhere on this scale. There's very few fully integrated practices, and fortunately, there's very few fully siloed or isolated practices anymore, because we've seen that the need for integrated care is very high. I put this in here because it's way too complicated, but it really points to how complicated integrated care can be. I mean, there's so many different ways that you have to go at it, from a primary prevention standpoint all the way up through continuing care. There are things that we need to be putting into policy, into individual practice, things that we need to be better researching, but it's all over the place. And there's not a lot of consistency across Ohio, let alone the country. The biggest piece of it, though, is that we need to detect people that are at risk, both on this risk for psychosis and risk for physical conditions earlier. When you identify people earlier, you improve the prognosis of outcomes, and you can start preventive medicine and preventive treatment earlier on. In a variety of the ways that integrated care can look, one of them is that the community mental health center might be the medical home for many patients, and psychiatry might have a role to expand it beyond traditional practice into management and treatment of medical conditions. So the figure is a decision support algorithm for physical health management by a psychiatrist. It's from a Vanderlip article in 2016. And really, coordinated specialty care teams play a critical role in helping coordinate mental health and primary care, which all of you know. Primary care clinicians for a large group of the population might be the initial and ongoing point of contact, to be more traditional medical home. Ideally, primary care clinicians would recognize symptoms and have access to coordinated specialty care teams and early intervention. And we know that when you can pull this off, it is both clinically effective and very effective on reduced costs of the whole system. I included this slide just because it shows that when you look at what kinds of symptoms have been tracked in primary care records, you can start to see some symptoms, and it's a complicated article, but the summary of this is you can see some symptoms were being recognized and identified by the primary care clinician as early on as 4 years prior to a diagnosis of schizophrenia. So they're seeing stuff. The problem is that not a lot of general practitioners or primary care providers are necessarily trained to fully understand how, and they might know from an educational standpoint how to diagnose schizophrenia, and we can read the DSM and see what the criteria are. But we all know that it takes a really refined eye also to be able to piece some things apart. One of the things that they're doing in the UK to try to alleviate this, is in addition to extra education and having a consulting provider and using coordinated care teams, is actually to have an algorithm that's based within their electronic record or a website that they could go in, and that the algorithm figures out the risks for, and can tell them, yes, you need to send this person to a coordinated specialty care team now, or maybe not just yet. The incidence, like I said, the incidence of schizophrenia is higher in low-income communities, and lifestyle risk factors are still greater for people with schizophrenia than other mental health disorders, even when controlling for socioeconomic issues. But all of this is extremely interrelated, which is why we truly need that integrated team. The World Health Organization does recommend that lifestyle interventions are considered the first-line strategy for managing physical health status in adults with severe mental illness. So things like smoking cessation, increasing physical activity, paying good attention to diet and nutrition. And those are all things that your teams are very much able to assist with to some degree. I mean, definitely we want to even expand the team, bringing in people like nutritionists and people who have backgrounds in exercise science if we really were to get a fully integrated team. But there's potential tools, even with smartphone apps, to be able to tap into each of the areas of coordination and each of the areas that your teams hit on. Smartphone apps and technology, like we see with Project Echo, can help with case management and team communication, recovery-oriented psychotherapy, medication, coordination of primary care services, which is really what all of this is about. It's so much of teamwork, or so much of integrated care really is about creating a team and figuring out how to communicate across your team. And of course, that team including the family, providing them both education and support. And the more that I think about and learn about integrated care, and I've been working at I think I've been at NEOMED for 7 years now, working specifically on integrated care. And I've really gotten to a point where I like to consider it from a syndemic approach. And syndemic is a word that I've seen more in the literature, that it's kind of a synergistic epidemic, where when you have multiple health conditions that are interacting with one another, also taking into consideration social, environmental, and economic factors, and how all of those things interplay to create a higher risk of vulnerability, and really further impacting equity and health, social determinants of health, the health disparity across the population. So when I think integrated care, I really am truly trying to step beyond just integrating primary and mental health, but also integrating social contexts and communities, whatever is going on in the person's life that really impacts wellness. I mean, we need to take it from that larger wellness point of view, and the systemic approach helps us to do that. So that's my takeaway message, is that when we think about integrated care, don't just think about how do I talk to the primary care provider. Think about how you pull in all aspects of health and wellness to truly do more broad integration. Lots of references, and you can have a copy of these slides with all of those references. And the other thing is that I offer as a resource is we have our integrated care ECHO program that runs every Friday. So if you have an integrated care question and you don't want to wait till the next FEP session, you are more than welcome to bring it to our ICANN ECHO program.